I said this acid and base balance. So acid is the hydrogen ion concentration, and acid also the end product of metabolism. And liver is the main organ in the body where metabolism take place. What is metabolism? Metabolism is a chemical reaction. By the chemical reaction, body can produce energy as a ATP. But here we learn the acid is produced because of metabolism. And acid is the chemical substance. And acid is the hydrogen ion concentration. And to make the balance in our body, we also need basic or base. What is base? Base, they said base contain no hydrogen ion, and any hydrogen ion acceptor that accept the hydrogen ion from acid to neutralize or decrease the strength of base or to form a weaker acid. So basically, base is the opposite chemical substance of acid. Acid and base always be balanced in the body and make a neutral environment where natural chemical reaction occur. What is chemical reaction? Chemical reaction is the two chemical substance react each other and make a new product. My friend, very important, just try to get me. I said two chemical substance react each other and formation new substance. It is easy definition, but something is missing. Two chemical substance is not possible to make a chemical reaction in absence of enzyme. In presence of enzyme, two chemical substance react and produce new substance. So enzyme is most important to start a chemical reaction in between two substances. So this enzyme can active in presence of neutral environment in the body. What is neutral environment? Means equivalent condition of acid and base. Equivalent condition of acid and base, right? This is the neutral environment where enzyme can active, because enzyme is important to start a chemical reaction and produce new substance. So keep in mind, if there are no chemical reaction take place in our body, mean no energy production, because chemical reaction in the metabolism, body can produce energy and we need this energy to survive. If no chemical reaction, means no energy. If no energy produced, we will die. So here the two important points. I said chemical reaction is important to produce energy, but this chemical reaction possible in presence of enzyme. Enzyme is a protein. They be active in in neutral pH. When neutral pH means hydrogen ion concentration or acid when normal or base when normal, they make equivalent environment in the body. So who make the equivalent environment in the body? Buffer. So you can see in the monitor buffer. So buffer is the system they can regulate hydrogen ion concentration. They can regulate the hydrogen ion concentration. I said for NCLEX board, we need basic ideas, not too much. Okay, so you see this is the picture everybody can see. This is a symbolic picture, right? So I said the pH or hydrogen ion concentration. pH means hydrogen ion concentration. So pH has a particular number or values. So normal pH, normal pH, so normal pH is 7.35 to 7.45. So if you have a look on the picture, this is showing the pH. The normal pH is 7.35 to 7.45. If the pH less than 7.35, this is acidic. If the pH is more than 7.45, this is basic or alkaline. You see the picture showing the blue, green color. This is the range of normal pH where the maximum chemical reaction take place. A normal pH range is 7.35 to 7.45. You must know it if you really want to understand acid and base. So if the pH is less than 7.35, acidic environment. If the pH is more than 7.45, this is alkaline. All right. If the environment too much acidic, our body tissue will die. If our environment is too much alkaloid, body will die. So make a balance is very important. And who make the balance? Buffer. Buffer is the substance who can make the balance in the body. So there are two notes here. One thing is they said, monitor the client respiratory status. Monitor the client respiratory status very carefully, and also monitor the client respiratory status closely. In acidosis, the respiratory rate and depth increase in an attempt to accept okay, so monitor the client respiratory status closely. In acidosis, the respiratory rate and depth increase in an attempt of exhale acid. And in alkalosis, the respiratory rate and depth decrease. Carbon dioxide retention to neutralize and decrease the strength of excess bicarbonate. So what we understand from this red line said we have to monitor the respiratory status, right? Respiratory. And in acidosis, the respiratory rate, acidosis, at least if you say, I do not understand what is acidosis, easily make it easy. Acidosis means when hydrogen ion concentration is less than normal. So in case of acidosis, the respiratory rate and depth increase. And in case of alkalosis, the respiratory rate and depth down. So if you ask what is respiratory rate increase and what is respiratory rate down, means we know the normal respiratory rate is 14 to 20. So this rate go up or this rate go down. So for NCLEX board, we have to know that in case of acidosis, the respiratory rate and depth go in. In case of alkalosis, the respiratory rate and depth go down. So on the other hand, here they said, when the client is experiencing an acid-base imbalance, monitor the potassium level closely, because the potassium move in or out of the cell is an attempt to maintain acid-base balance. So they said when the client experiencing an acid-base imbalance, you see, acid-base imbalance. So I believe everybody know what is electrolyte. Electrolyte means sodium, potassium, calcium, phosphorus. But out of all, most important is the potassium, because patient is die because of arrhythmia, hyperkalemia or hypokalemia. Both are dangerous. Patient die. So I said when any patient acid-base imbalance means maybe the electrolyte imbalance. So when any patient has a chance of acid-base imbalance, we have to monitor the potassium. On the other hand, I want to explain, my friend. Acid and base both are liquid, and our body need to be neutralized environment. Acid must be balanced, base must be balanced. But if in a medical condition body lost the fluid, that times acid base balance be imbalance. And as we know that when you see your patient has a chance of acid base imbalance, you have to check electrolyte, especially potassium level. So now question come, what are the medical condition when acid base balance chance to be imbalance? Easy example, like a patient came to you with a nausea, with a vomiting. Vomiting means too much fluid loss through the upper GIT. If a patient came to you with a diarrhea, means too much fluid loss through the lower part of GIT, through the rectum, and fluid loss, chance of develop acid-base imbalance. A patient came to you with a huge blood loss, means imbalance of the fluid, and patient chance to develop acid-base imbalance. So as a healthcare provider, when you see your patient has a chance of acid-base imbalance, You have to check electrolyte. Out of all electrolyte, most important is potassium. So what they said in this book, when the client experiencing acid-base imbalance, monitor the potassium level closely, because the potassium move in or out of the cell is the attempt to maintain acid-base balance. The resulting hypokalemia or hyperkalemia is predispose the client to associate complication. So potassium is go down, hypokalemia, or potassium go up, hyperkalemia. So both are dangerous for the patient. Both can lead to imbalance of the acid and base, right? So first of all, from this page, what we have to know to answering the question for the board, we have to know this picture. This picture saying the green line, pH, hydrogen ion concentration, pH. The normal hydrogen ion concentration in the body, 7.35 to 7.45 is the normal. If the pH less than 7.35, acidic. If more than 7.45, this is alkalosis. This is our first steps to answering acid-base type of question. So in this picture, just showing the concentration of hydrogen in the body and what condition tell what. When concentration increase, when concentration is reduced, and what are the normal. So in the, if I talk about the here acidosis, the extracellular hydrogen ion concentration increase. Alkalosis, more hydrogen ion are present intracellular fluid than extracellular fluid. So if you say, I mean, intracellular means the inside the cell. Extracellular means outside the cell. So they said, last picture, picture number 3, in alkalosis, more hydrogen ion are present intracellular fluid, more hydrogen ion concentration. It is alkalosis. But the picture number 2, extracellular means outside the cell. Extracellular hydrogen ion concentration increase means more hydrogen ion out of the cell. So hydrogen ion move into extracellular fluid. And the first picture showing the normal condition. The intracellular potassium concentration is much greater than the extracellular fluid, because this is a normal physiology where always intracellular hydrogen ion should be more than the extracellular hydrogen ion. If it is not this balance, they make imbalance, and when imbalance either lead to acidosis, either lead to alkalosis. So here two most common terminology come. One is called the alkalosis and is called acidosis, like respiratory acidosis or respiratory alkalosis. Just make easy definition. The respiratory acidosis, the total concentration of buffer base is the lower than the normal, with relatively increase in hydrogen ion concentration. Thus, the greater number of hydrogen ion is circulated in the blood and then can be absorbed by the buffer substance. So basically there are four terminology. One is called respiratory acidosis or alkalosis, or metabolic acidosis or alkalosis. If I just give one focus on respiratory alkalosis. So respiratory, just simple meaning of the system. Respiratory alkalosis or acidosis, whatever it is, the term is respiratory. If I ask you, what does it mean, respiratory? Your answer would be, respiratory means maybe my lungs is involved, my lungs. Respiratory alkalosis or acidosis, your lungs involved, right? At least make easy for we are very beginning level. And metabolic acidosis and alkalosis, metabolic, I said. What is metabolism? Already you know. Metabolism is a chemical reaction take place in the liver. So metabolic problem means maybe something related to the liver, but metabolism not only the liver, the metabolism involving liver and GIT, because you eat food through the mouth, then food go mouth to esophagus, then go to the stomach, and finally when food is make a small particles, these small particles go through the circulation, portal circulation, enter to the liver. So there are some relationship between GI and liver system, because GIT not only the alimentary tract, we have some associate gland can help in digestion. This associate gland is that liver or pancreas or gallbladder. So liver, pancreas or gallbladder all are the part, associate part of gastrointestinal system. So if I ask you, respiratory alkalosis or respiratory acidosis means the problem only the lungs or our respiratory system. But if I say metabolic acidosis or metabolic alkalosis, problem maybe in the liver, maybe in the pancreas or GIT, gastrointestinal system, the problem in the system. So I'm just going to focus the red note from this sender book because it is too big. It is not possible to cover every sentence, but I'm just trying to focus what need for NCLEX board. So they said if the client has a condition that causes an obstruction of the airway or depressed the respiratory system. So you see the first two line, the problem in the respiratory system. So the clinical diagnosis would be respiratory acidosis or respiratory alkalosis, because the problem only inside the lungs. So lungs problem diagnosis, not a metabolic acidosis or alkalosis. So if the client has a condition that cause an obstruction of the airway or depress the respiratory system, we have to monitor the client for respiratory acidosis. Respiratory acidosis, I said. So again, something is very important. So respiratory acidosis. So if the patient has a respiratory problem only, respiratory tract problem. So if anything problem related to your respiratory system, upper respiratory or the lower respiratory, the problem must be in between respiratory acidosis or respiratory alkalosis. If any disease that causes breathing too fast, breathing too fast, any medical condition related to the lungs and breathing too fast, this type of problem is called respiratory alkalosis. Another respiratory or lungs problem, the breathing is too slow, that causes respiratory acidosis. That's I just make it easy first of all. So now go next one. Here they said some difference between respiratory or metabolic, neurological sign and symptom. Both are acidosis. So in case of respiratory acidosis, patient should be feel drowningness or disoriented, or patient feel dizziness or headache, and let, if untreated, they undergo coma. And whereas the metabolic acidosis, patient is also feel drowsiness or confusion, headache. If untreated, lead to the coma. Coma means before death. Patient is unconscious. Whatever the change in cardiovascular system in case of respiratory acidosis, they say decrease the blood pressure, dysarrhythmias. Same metabolic acidosis decrease the blood pressure, dysarrhythmia. GI system, no significant findings, but metabolic acidosis, patient maybe have vomiting or diarrhea or abdominal pain. In case of nervous system or neurology, respiratory acidosis, patient maybe have seizure. What is seizure? Seizure means involuntary control of your muscle. But there are no seizure in case of metabolic acidosis. Now go here a question NCLEX board asks. In case of respiratory acidosis, what are the nature of respiratory rate? Respiratory rate, this is called hypoventilation with hypoxia, right? Like imagine your patient has a respiratory problem. Maybe breathing is too fast or breathing is too slow, right? Breathing is too fast or too slow. Patient oxygen, body do not get enough oxygen if your respiration is too slow or too fast. And when body does not get enough oxygen, this is called hypoxia. What is the metabolic acidosis? What are the patterns of respiration? They said deep, rapid respiration, deep and rapid. The deep and rapid respiration is called Kussmaul respiration. So in case of diabetic ketoacidosis, the respiration is too deep and rapid. So Kussmaul respiration is most common in diabetic ketoacidosis. Kussmaul respiration also common in case of metabolic acidosis. Now go here, the red note, right, for NCLEX book. So the client with history of emphysema. So emphysema is the lungs problem, respiratory problem, chronic obstructive pulmonary disease, COPD, is a lungs problem. So if your patient has a COPD or emphysema, they have to diagnose either respiratory acidosis or respiratory alkalosis. I said if your patient has a respiration rate is too slow, maybe there is acidosis, respiratory acidosis. If your patient has a breathing is too fast, it is respiratory alkalosis. So question do not ask like this, but you have to make some sense. If your patient is came from running, my means marathon runner, suddenly fall. What about change? Marathon runner means breathing is too fast, and marathon runner, their respiratory problem because he's breathing too fast, not GIT problem, because when anybody is running, they will not eat, they only run, because running and eating is not possible. Am I correct? If you want to run to 100 meters, same time you will not eat. So respiratory, sudden a patient is marathon runner and suddenly fall means the patient is respiration is too fast. So the problem, and as I said you, if the respiratory rate is too fast, the problem is respiratory alkalosis. If the patient has COPD or emphysema, the breathing is too slow, means the patient diagnosed with a respiratory acidosis, right? So they said, usually I'm not giving oxygen greater than 2 liters by cannula, since a higher level of oxygen in the blood may decrease the stimulus of the breathing, leading to carbon dioxide retention and causes respiratory acidosis. Respiratory acidosis. They slow down the respiratory rate or breathing and causes the change of acidosis. And here's something talk about respiratory alkalosis. If the client has a condition that cause overstimulation of respiratory system, or monitor the client for respiratory alkalosis, I am going to reread it. If the client has a condition that causes overstimulation of the respiratory system, monitor the client for respiratory alkalosis. As per I told you, if the breathing is too fast, it is respiratory alkalosis. Here they said, if the client has a condition that causes overstimulation of respiratory system, means breathing too fast, the diagnosis should be respiratory alkalosis. And now we are going to respiratory alkalosis and respiratory metabolic alkalosis, some sign and symptom. So respiratory alkalosis, neurological sign, patient has a lethargy or light headache or confusion. And metabolic alkalosis, patient has a drowsiness or dizziness and confusion. It is same as metabolic acidosis. And cardiovascular change, both cases, respiratory acidosis or respiratory alkalosis or metabolic alkalosis, both case patient has a tachycardia. Tachycardia means increase the heart rate. If anybody has a tachycardia, they have also palpitation. If anybody has a tachycardia and palpitation, both lead to the anxiety. So if anybody has a palpitation, they have tachycardia or anxiety. If anybody has a anxiety, they have tachycardia or palpitation. So one lead to develop other. So GIT problem, in case of metabolic alkalosis, patient has a nausea, vomiting or abdominal pain. Whereas the metabolic alkalosis, patient maybe has a nausea or vomiting, but no diarrhea here. And now go the another note from about the metabolic acidosis. A total concentration of the buffer base that is lower than normal. So buffer is the substance or protein they can make the balance of acid and base in the body. And metabolic acidosis, basically an insufficient supply of insulin in the client with diabetes mellitus can lead to metabolic acidosis, or it is called diabetic ketoacidosis. So if your patient has a diarrhea, the patient chance of develop metabolic acidosis. If your patient has a vomiting, the chance of develop metabolic alkalosis. If your patient has a insulin deficiency, the patient can develop metabolic acidosis, or it is called diabetic ketoacidosis, because the body can produce ketone body, and ketone body is an acidic substance, and the concentration of acid increase. So on the other hand, I want to explain, as far I said, the GI or metabolism is not only the liver. This is the combination work of GI, pancreas, and liver. So when the liver problem or liver disease or pancreas disease, patient has to have the metabolic acidosis or metabolic alkalosis, not a respiratory acidosis or alkalosis. And next here, they said red note, we have to monitor the client experiencing the severe diarrhea for manifestation of metabolic acidosis. For NCLEX board, what we has to know? We need to know if a patient has a diarrhea, what take place? Metabolic acidosis. If patient has a vomiting, what kind of change take place? They have a metabolic alkalosis. If patient has a diabetic, which one chance of develop metabolic acidosis, most commonly called diabetic ketoacidosis, right? And here I want to share another example. When blood gas or when the blood gas values, would you expect to see in the client in acute renal failure? Sometimes I said if the kidney involved also causes metabolic acidosis. Kidney involved. Kidney is not related to the lungs. Kidney is related to the our GI, fluid loss, electrolyte loss. So it is metabolic change, right? So if a patient if a patient is under gastric suctioning means feeding tube inside the mouth. What kind of change place? Metabolic, because fluid loss. So go next here. Here, monitor the client experiencing excess vomiting or the client with gastrointestinal suctioning for manifestation of metabolic alkalosis. So vomiting, I said metabolic alkalosis. So when we use the suctioning machine or tube, that times chance of develop bicarbonate ion increase or pH level increase and patient develop metabolic alkalosis, right? And here acid is arterial blood gas analysis. So arterial blood gas analysis can help us to understand the concentration of hydrogen ion or the concentration of pH, right? So blood gas analysis is the most important to calculate the metabolic change or alkaline change. So here the blood gas analysis. So collect or connection it is shortly called ABZ. So we have to collect the blood and then check pH in the blood, can check the oxygen concentration, and also we can check the bicarbonate ion. So they said obtain the vital sign, determined whether the client has an arterial line in place. Just collect it to check the blood gas. So here in the showing the picture in the blood gas analysis, what we can check? We have to check the pH. pH means hydrogen ion concentration. We have to check the partial pressure of carbon dioxide. Partial pressure of carbon dioxide. So carbon dioxide, the marker of respiratory change. Carbon dioxide in the lungs, bicarbonate ion. They are the marker of GI or gastrointestinal change, and the partial pressure of oxygen. The pressure of oxygen can make you understand your patient condition. The normal pace, as I said at the beginning, 7.35 to 7.45 is a normal. What are the normal partial pressure of carbon dioxide? 35 to 45 millimeter of mercury. The bicarbonate ion, shortly called CO3. Bicarbonate ion, the hydrogen concentration is 21 to 28, and normal pressure of oxygen 80 to 100 millimeter of mercury. So to answer the question in NCLEX board, we must know what is the normal values of high pH, partial pressure of oxygen, partial pressure of carbon dioxide, and partial pressure of bicarbonate ion. So as I said you, the what we have to learn from here. So partial pressure of oxygen, this is the marker of respiratory problem. Bicarbonate ion is a marker of metabolic change, right? Go next here. So in the red line, in the respiratory imbalance, they said blood gas analysis result indicate the opposite relationship between pH and partial pressure of carbon dioxide. In a metabolic imbalance, the blood gas analysis showing or indicate the corresponding relationship between pH and bicarbonate ion. So when we go and check the metabolic blood gas analysis, we can see the normal range of pH, or we can able to see the partial pressure of carbon dioxide or the bicarbonate ion concentration. So if the patient has a metabolic metabolic problem, we always can see abnormal in bicarbonate ion. If the patient has respiratory problem, we can see abnormal number of partial pressure of carbon dioxide. So after the break, I'm going to explain more about the acid base balance, and we are going to make it easy.